Nigerians. Tune in to the sunny side on Eagles 102.3 FM. Every weekday from 2 to 6 p.m. Oh my God! Seriously! The Sunny Side Show. The Sunny Side Show.
Don't worry, it's not Corona.
From Milky Way to Earth, everywhere there's internet, you can connect with Eagles 102.3 FM Abuja. Log on to our website, www.eaglesfm.com. Follow and engage with us now on Facebook, Twitter, TikTok at Eagles FM Abuja, Instagram at Eagles FM 1023. Download our apps on your Android and iOS stores. Eagles 102.3 FM Abuja, your radio experience you can count on.
Are you ready for this?
Keep this frequency clear.
We're live. Welcome to the Eagles FM 102.3 Abuja.
301 right here on your radio experience you can count on, and it's about time for us to get into the entrepreneurial show. And today on the show I have got Dr. Anne Ene Adah-Ogoh. I hope I'm correct with that name, the pronunciation.
Absolutely.
All right. So Dr. Ene is, or Dr. Anne rather, she is the head policy of PSHAN, which stands for Private Sector Health Alliance of Nigeria. Hello and welcome.
Thank you very much. It's a pleasure to be here.
It's a pleasure to have you. And she has a very beautiful smile, by the way. You should smile often. Okay, now moving on. Now, talking about the private sector for health in Nigeria, what exactly is that about?
So Private Sector Health Alliance in Nigeria is an umbrella body that pulls together private sector resources from different private sector players in order to improve health outcomes in Nigeria. We realize that even though health is supposed to be the purview of the government at different levels, government alone is unable to put together all of the resources that you require. And therefore, Private Sector Health Alliance steps in to help to bridge this gap with healthcare financing. The ultimate objective for Private Healthcare Alliance is to improve health outcomes for all Nigerians so we can achieve universal health coverage by 2030.
So this health covering that we're talking about, is it more like an insurance scheme, or is it in collaboration with the government?
So Private Sector Health Alliance basically works across all the spheres of health care for Nigerians, basically. So we look beyond healthcare financing. We look to everything that strengthens the health system, which includes governance, building capacity for human resource for health, training, research, evidence and learning, and everything across the value chain for health sector in Nigeria. Most of our work is done to support the current effort of government to improve healthcare for all Nigerians. So we basically are a support system working with government to improve efficiencies and effectiveness across the value chain for health sector in Nigeria.
Now, the programs that are under this sector, what are they? Can we hear them?
So we have, which would include COVID awareness program, the COVID vaccine awareness and hesitation program. We have a Shaping Healthy Market for Sexual and Reproductive Health initiative. But our biggest program is the Adopted Primary Healthcare Facility in Nigeria, which looks to provide one world-class primary healthcare center in each of the 774 local government area in Nigeria. That's our flagship project right now, in addition to some of the other areas of intervention I'd earlier mentioned.
Now that's the that particular one. It's a new what? Program you just launched. Can we hear more about that?
So the Adopted Primary Healthcare Facility has been around for about 2 years. The official launch was held on November 10th in Lagos to create more awareness, to also raise more funds from the private sector to support the National Primary Healthcare Development Agency to roll out primary healthcare centers in each of the 774 local government area in Nigeria. That project is targeted at either building new healthcare facilities at primary healthcare level or upgrading existing facilities at primary healthcare level, because primary health care is the basic unit for providing health care for Nigerians. The aim is also to ensure that we take health care closer to the grassroots, that people, wherever they are, irrespective of the distance they are from the health facilities, can get health care as close to them as possible at affordable rates, and also to ensure that the quality of service is standardized to a point where we improve the healthcare indices in Nigeria currently.
Okay, so speaking about the grassroots and healthcare, how exactly can this work? Because there are a lot of factors when it comes to health. I mean, there is the water that they drink, there is the food they eat, there is also the surroundings where they stay. How exactly can adopt a primary health facility? How can this help them with all of this?
So adopt a primary health care facility is not just about providing services in the hospital. It's also about creating awareness for Nigerians to take better care of their health. It's also about encouraging a healthy lifestyle. It's also about people accessing health care as quickly as they need it, when they need it. We are also involved in the area of water, sanitation, and hygiene. We're also involved in the area of promoting healthy lifestyles for Nigerians. And we're in the business of supporting Nigerians for a better care to improve their health care indices across the spectrum. So beyond just providing health services, we are also looking at all the other social determinants of health that you mentioned that provides holistic care for healthcare services in Nigeria. The adopted primary healthcare facility right now, through our board of directors and people that we call sponsors, who are largely captains of industries, have committed to adopting each one primary healthcare center or a couple of primary healthcare centers across Nigeria. And so the project has two sites that have come live, one in Delta State and one in Bauchi State. We probably will be rolling out another 20 in 2024, and we hope to continue along that trajectory until we cover the 774 local government area in Nigeria.
Now, what exactly has been the struggle? Because I understand that going into this local government areas, there has been a lot of things that you would have to face. I mean, with the acceptance of this and with people knowing how they can access healthcare. What exactly have the struggles been?
So one of the biggest challenges that we have is getting people to take responsibility for their health-seeking behavior in Nigeria. So a lot of awareness, campaign, and advocacy is required for people to be able to take better care of their health. In addition to that, there's also the struggle for financing, which is real, because a lot of payment for health services in Nigeria is out of pocket. More than 70% of payments in hospitals is due to or comes from people paying out of their pockets. And where you have a lot of people living below poverty line in Nigeria, it becomes difficult for people to be able to put money in their hands put their hands in their pockets to pull out funds to pay for their health services. And so most times people decide not to seek health care because of cost. The health insurance is supposed to step in to midwife the payments for people, but a lot of people also do not have access to health insurance. We also have the issues around quality human resource for health in the health centers. So how do you ensure that the health centers are adequately staffed in the number and with the capacity for which you require to provide quality health care services? A lot of times, what we have aimed to do through the adopted primary healthcare facility is to see how we can holistically address these challenges so that we can improve the quality of healthcare and ensure that people can get access to quality healthcare services at affordable prices. So some of the biggest challenges we face right now is also ensuring the sustainability of interventions that have been put in, the funds that we're pumping into the system right now. We want to ensure that the systems are strong enough so that the programs can remain even after the project has ended. So we're looking at ensuring that we have accountability mechanisms in place, we put a governance structure in place, we have a quality assurance framework in place to make sure that quality services are delivered as at when people need it, and that beyond the life of the project, the services can continue in the hospital.
Okay, now seeing as this is a private sector, how exactly does it work? You know, there are certain people that are not sure how health insurance schemes work, but this is different from health insurance schemes. So how does your Adopt a Primary Health Facility program work?
So the Adopt a Healthcare Facility, a primary healthcare center, works through adopters. We have individuals who are interested in supporting access to healthcare, particularly at the primary healthcare level. These people put funds together to support the upgrade of infrastructure and also put funds to ensure that we can support these healthcare facilities over a period of 5 years. These individuals, whom we refer to as adopters, come together in partnership with Private Sector Health Alliance of Nigeria and commit their funds to this process for a period of 5 years. So working together with the state government and the local government health authorities, we're able to renovate these facilities, ensure that they have adequate staffing, adequate drugs, commodities, and they have a good governance structure in place, and that people are aware enough to be able to access healthcare services. And we run these facilities for a period of 5 years and transition to government so that government can take over and continue to run the healthcare facilities.
All right, we've been speaking to Dr. Anne Ene Adah-Ogoh of the Private Sector Health Alliance of Nigeria. She happens to be the head of that company right now. Anyway, we're still speaking right here on your radio experience. You can count on. Don't go anywhere.
If you ever find yourself stuck in the middle of the sea, I'll sail the world to find you.
Ene Adah-Ogoh. I'll just stick with Dr. Anne. I earlier on mentioned that she was the head of the private sector. My bad, it is the head of policy at Private Sector Health Alliance of Nigeria. All right, now she is also the head of the programs as well. And we've been talking about the program that they have, that they've launched 2 years ago. That is Adopt a Health Facility program. We've been speaking about how it works, very enlightening, but I would like to know, you spoke about it being a grassroots program. Now, you also mentioned that there are 774 local government that you guys want to enter into and make sure that everybody has good health facility and is taken care of. Their health is considered before 2040. Yes, was it 2040?
2030.
2030. Okay. Now, I'd like to know what exactly is the plan to get this number of local government involved in this?
This project is heavily dependent on Nigerians, members of the private sector, who are interested in adopting one primary healthcare facility. People can come together to adopt one primary healthcare center. Communities can come together. High net worth individuals can come together to adopt primary healthcare centers in their locations or in anywhere within any of the 774 local government area where they have interest in. Some local government areas have already been adopted. Some states have been adopted by high net worth individuals and supporters of the initiative. In Kano State, for example, has 44 local government areas, and all the 44 local government areas have already been adopted, courtesy of one of our directors. Delta State as well has 25 local government areas. 25 of them have one PHC each adopted by one of our directors as well. Another 23 already has been adopted in Edo State by another of our directors. another 25 from Rivers State, and then we have 2 in Bauchi State. We have a number of people who have come forward, a number of organizations who have come forward as well to indicate their interest in partnership with the Private Sector Health Alliance on this laudable project. And we continue to encourage people to come forward to adopt 1 PHC or 2 PHCs or a group of PHCs. But aside from bringing funds to the table, we also encourage individuals. We have a group of wonderful volunteers who contribute their time, their talent, their resources to support the cause, because there's a lot to be done for us to get to where we want to go to. So regardless of what capacity that people can support us in, people who are accountants, people who are quantity surveyors, people who have expertise in any area that can add value to the project are very welcome to contribute their time and their resources to support the project.
Now, for those people that would need the health care, how exactly can they get in?
So for people who would need health care, once we are adopting a primary health care center in your locality, then we have a community entry process where we create awareness. We have an engagement process with different structures in the community, including traditional leaders, faith leaders, opinion leaders, change agents, influencers, people who talk to the people and take the news abroad, so that everybody is aware as to what opportunities now exist in there. We also, for those who struggle with paying for healthcare services, we are also able to create a linkage between them and the health insurance agencies, so they can be supported through the basic healthcare provision fund, particularly the one that caters towards the more vulnerable population, so they can access healthcare insurance to support them to pay for their health bills in the hospital.
Now, speaking about vulnerable, the people that are vulnerable, is there a list for that? Can we hear it?
So when we talk about vulnerability, there are different indices of vulnerability. So some people are vulnerable because of their socioeconomic status. Some people are vulnerable because they live in disaster-prone areas. Some people are vulnerable because they have suffered loss of breadwinner or loss of whatever means of livelihood that they have. So we have different categories of vulnerability. And when we get into the community, we have a vulnerability index that we work together with community members to identify the most vulnerable and the poorest of people in these communities. And we create these linkages between them and the state healthcare insurance agencies, so they can have access to health insurance and be able to pay for their health care.
Okay, now speaking about these people, you also mentioned that it was for 5 years. Now, this 5 years we were talking about, is it that the health care is for 5 years, or the sponsors are sponsoring for 5 years?
So the sponsors are sponsoring for 5 years. And in the period of 5 years, we're also building capacity of the local government and the state agencies to be able to take over from where we have stopped. We're also setting up mechanisms within the healthcare centers to ensure that they can continue to have access to healthcare financing to sustain the level of services that we will provide for them in the period of 5 years. So beyond service delivery, this project also looks at capacity building, ensuring governance, improved accountability on all fronts to ensure that sustainability of the project remains even after the life of the project.
All right. Now, speaking about sponsoring the project, how exactly can people join in? You've gone on to mention that people could be volunteers, people could come up and walk up and sponsor, but how exactly can they get in contact with PSHAN?
So to get in contact with PSHAN, the Private Sector Health Alliance, you can get on our website, www.pshan.org, and then you can get all the information you want on the project. You can also reach out to any of us. We will be glad to send you a prospectus. We will be glad to interact with you and provide for you all of the information that you require. But the first step is to go to the website, where we have a lot of information and a lot of updates on the Adopted Primary Healthcare Facility project so that you can get acquainted with the mechanisms. The prospectus is also on the website, so you can get acquainted with the mechanism of how to become an adopter or to become a volunteer to support the cause.
Okay. I would like to ask these questions for people that must have that question, because truth be told, thinking about it, I feel like these people that are volunteers, people that are coming up to volunteer, let's say if they're working towards their getting a certificate as a doctor or something, does it count? Would it count for them?
So most of the people who have volunteered to work on the project are people who are established in one field or the other. We've had chartered accountants, we have accountants, we have quantity surveyors, we have people in different spheres of life.
So not just health sector?
Not just health sector, just across a broad spectrum of anybody who can provide services along the value chain for healthcare services. So we go into a facility, for example, we need to do a renovation. So we would need quantity surveyors. We need people who understand how a clinic flow should run. We also need accountants to help look at the books. We need pharmacists who are able to look at the drugs, the pharmacy, the supply chain mechanism. We also need people who have expertise in advocacy, media campaign, to push the message abroad, to be able to increase the volume so that people can be aware of what's coming to the community, the modalities for engagement, and then they can tap into these opportunities and support the projects.
All right, so I have been speaking with Dr. Anne. She is the head of policy and program at PSHAN. And yes, we've been talking about the health sector generally and of course what they do at PSHAN. And yes, the program that they have, the Adopt a Primary Healthcare Facility program that they have running right here. Don't go anywhere. We are still here talking entrepreneurship. If you happen to be interested in joining the program, that is the Adopt a Primary Healthcare Facility program, you can go ahead. If you want to be a volunteer, you want to be a sponsor, you want to be an adopter, according to what Dr. Anne has been talking about, you can go ahead and visit their website. Let's hear it.
So the website for the Adopt a Health Facility project is adhfp.org. adhfp.org. You can also reach us on 09077253255. I'll take that again. 09077253255. And then our Twitter handle is at PSHAN_alliance. At PSHAN at PSHAN_alliance.
Let's have the phone number and the website again.
The phone number you can reach us on if you're interested in volunteering or taking up any of the primary healthcare centers as an adopter is 09077253255. The website to get all of this information is adhfp.org.
Okay, so you have heard it. You can go ahead and check out the website if you happen to be interested, or if you have more questions, you can call 090-7725-3255. And of course, you can also check out their Twitter handle, that is at PSHAN_alliance. Go ahead and check it out. Thank you so much for coming, ma'am.
Thank you so much, and we look forward to hearing back from Nigerians who would like to have many people as possible adopt, who would also like as many people as possible to join us as we work to improve healthcare indices for all Nigerians by 2030. Thank you for having me here.
All right. Have a very, very lovely day. Okay.